Fury erupted today after the government confirmed police officers and teachers would not be bumped up the COVID vaccine priority list once the NHS has made its way through 32 million people in the top 9 priority groups.
Ministers announced they will continue with the age-based approach recommended by leading scientists, paving the way for everyone in their 40s to be jabbed in April before the rollout eventually reaches every remaining adult.
But police and teaching unions were outraged at being ignored in the next phase of the inoculation drive.
Metropolitan Police Federation Chief Ken Marsh slammed the absurd plan, calling it absolutely disgusting and arguing that health officials don't give a damn about us.
Geoff Barton, General Secretary of the Association of School and College Leaders, also attacked the announcement, telling the BBC that prioritising teachers would reassure them and minimise disruption to education caused by staff absence as a result of COVID. Neil Leach, Chief Executive of the Early Years Alliance, EYA, accused the government of being lazy in its decision not to prioritise key workers.
Ministers today confirmed they will follow the age-based rollout recommended by the Joint Committee on Vaccination and Immunization, JCVI. It means they will move a decade down at a time, rather than offering people jabs based on their job, ethnicity or whether they're obese.
The JCVI has said there is no scientific argument for teachers or police to get the jab ahead of their peers because data shows they are not more likely to catch or die from the virus than others.
Trying to offer jabs to key workers such as teachers or police officers first would be more complex to deliver and may slow down the vaccine program. Matt Hancock will confirm the update at a 5 p.m. Downing Street press conference tonight. More than 18.7 million people in the UK have already had at least one dose of a COVID vaccine, and Boris Johnson said he aims to have reached everyone in the top 9 priority groups by April 15. If this is achieved, it will mean half of the population of Britain and a group accounting for almost all COVID deaths have been immunized.
The program will then aim to offer a jab to every adult in the country by the end of July, roughly coinciding with the ambition to totally lift lockdown at the end of June.
JCVI bosses called for a campaign drive to target jabs at the most high-risk people in the remaining groups, namely men, ethnic minority groups, poorer communities, and obese people, who are more likely than average to get seriously ill but not at high enough risk to be in separate priority groups.
Professor Wei Lim, COVID chief at the JCVI, said in a briefing today that the vaccines being used in the UK are safe and work very well, as he urged all adults in Britain to be ready to join the queue to get their jab. It comes as official figures revealed today that England's coronavirus outbreak has halved in size in a fortnight, but the speed of decline may have started to level off.
Office for National Statistics experts estimated 373,700 people would test positive for the virus on any given day in the week to February 19. But separate data from a symptom tracking app said daily COVID cases rose 3% in a week to 9,545 over the 7 days to February 21. And No 10's top scientific advisory panel SAGE estimated the R rate, the average number of people each COVID patient infects, is still at the lowest level since records began in June, staying between 0.6 and 0.9.
One leading scientist today urged Britons not to panic over the results, however, because the key measures of hospitalizations and COVID deaths were still falling, and said No 10 was still on track to lift restrictions sooner rather than later, as the UK is in a similar position to last May.
Positive attitudes towards the coronavirus vaccine have increased, with nearly 95% of adults saying they have either received the jab or would be likely to have it if offered, new data shows.
Office for National Statistics, ONS, figures, published on Friday, show 94% of adults surveyed between February 17 and 21 reported they had now either received the vaccine or would be very or fairly likely to have it if offered.
This is up from 91% the previous week and has risen from early December 2020, when around 8 in 10, 78%, adults indicated they would be likely to accept the vaccine if offered it.
Of the adults who said they would be unlikely to have the vaccine or had decided not to have it, the most common reasons were being worried about long-term impacts on their health, 43%, being concerned about the side effects, 37%, and waiting to see how well it worked, 34%.